with all knee replacement patients and all most of the time. So I deal with all the things like from the child birth to of how they're born is like a foot is inverted, CTV, we call it as CTV, to knee replacements, up to knee replacements, age-old knee replacements. So I'll see all the pediatric to ortho, like the age-old geriatric cases and all. You see in normal clinical OPD basis and all. So usually I see many patients here in the care hospitals. It's like a robotic surgeries. It's like knee replacements and any sports related injuries. That type of all surgeries we do it in care hospitals now. So today topic is ergonomics and nutrition. So how the ergonomics and nutrition works for you in your uh, day-to-day life. So ergonomics is a word usually we'll see in our work life, like how the people and things together work. We will have a nice work and work style and all without having any problems and all. So usually we'll see. I'll show you many things like in work style and all, how you sit, how you stand, and how you do your works in normal working style and all. Usually in this COVID times, so many people are not going to the offices and all. They are working from their home itself, and they are doing their works from home itself. So many people are, when I'm seeing in my OPD, so many people ask me the same thing, sir, can I do my work in sitting down or lying down, or in my home I can do in a different lifestyle and different type of ways. So in this ways, they're having many problems in different regions, like in neck or in lower back or in knees. Many problems are there. These are all work style ergonomics, which they are not following it, so that they are having so many pains in so many type of joints or so many type of this spine region and all. Usually ergonomics and nutrition will go together. If there is no nutrition in a proper way, then the working style also will be deteriorated, and the working people also will have many problems in during work usually. So usually I have taken some points to be taken in this ergonomics and nutrition. This psychological and social and biomechanical and physiological. These are the 4 areas. We'll touch it in this today topic. See, these are all related to how you work in your workplace or in your home. So psychologically, socially, and biomechanical and physiologically. These are many things. So psychologically, you should be stable to work, and socio-economically, how the people surrounded by you, how you there, and biomechanically, like how your body mechanics works for you in the during work, and physiologically, if you are physiologically active, then you can work more. So how the nutrition works to you in this ergonomics is now. This is a new word which is coined by some other surgeon in Switzerland. It's called nutra-ergonomics. Nutra-ergonomics. Nutra-ergonomics is like the nutrition comes, then the ergonomics also will come in place. So normally in working style, like when we are doing in normal working style in your working place and all, you sit in the chairs in a normal, the system will be there in front, and in the normal 90 to 90 chairs, usually they'll see the chairs like this or this or like this, and our phones are like this most of the time. See, usually when you are sitting in your chairs and all, you should be in 90. The elbow should be on 90, means like this. So then only you can have the access to the keyboard, and your eyes to be straight to the screen. Like the eyebrows have the straight area to the screen edge, so that you can see the screen straight, so that you can't bend your neck and you can't straighten. So if you are sitting for a long time in the same posture, you'll get backache and neck pains also. Okay. So in this, usually I will tell many patients now in my OPD and all, usually hydration is also very important. Hydration means water. So most of the time when you are sitting and working for a long time, every 45 minutes you do or you work or you do the things. So every 45 minutes take a break. Like if you are sitting for a long time, take change in the posture and put it in a stand, and you just walk for some time and come and sit for another 45 minutes, and you can do the work. If you are not doing this work and all, so in the same proper way, you'll have the same problems again and again. The spasm will increase day by day. And hydration is very necessary to all your bodies, like from brain to toe, all the muscles, bones, everything, hydration is needed. So usually I advise for 4 to 6 liters of water. So every time you keep a water bottle beside you and take more, have plenty of water, so that your hydration levels will have in a good way, and your proper hydration will be there. And inside in shifts, like so many people ask me, says I'm working for nights, I'm working in long time in nights, I don't have any morning jobs, I have only work in night. So that the job shifts are irregular shifts, there is no sleep at all. For that I'm telling you, so sleep is also a very necessary need in this COVID times. If you don't sleep for at least for 7 to 8 hours in a day, you'll have all the problems, like the body pains, the spasmodic problems, and the neck pains or the low back pains. And so many people are not going out of the house in these COVID times. So that what happens now, so you are not exposed to sun, or you're not exposed into the normal environment, and your body is not moving at all. The muscles are going into spasm. And if you're not going out of into sun and all, you're not getting the D vitamin in a proper way. If your D vitamin is not getting into your body in a proper way, the bones are getting weak day by day. Last 3 months of COVID, like last 90 days, no people are going out. They're not going out from the home, and they're sitting in the home for a long time. They're getting low back aches, neck pains, and bone weakness, and so many extra problems are there. So recent study on this, with less less vitamin D deficiency and all, there are more prone for COVID problems and all, or COVID virus, because they have less immunity chances and all. In this, uh, usually I advise people to go every 45 minutes, change in posture, and 6 liters of water, 4 to 6 liters of water, or any other fluids, like the coconut water or milk or some other nutrition. So this should be a 4 to 6 liters of water or 4 to 6 liters of fluids to be taken. And in food industry, so many people are now asking me many questions, like food industries are doing many ads to get your ergonomics, or to get all the nutrition to be fit to, they are advertising in a way, they, it is cholesterol free, it is healthy to your heart, it is healthy to body, and it's fat free, gluten free, like the type of products we are seeing now. Because of this, there is less increase in energy intake and less fatigue. Whatever this food type of, whatever healthy foods, whatever you're taking it, it increase your energy and less the decrease the fatigue. And usually when you're working more, so your energy will be getting less. So if you are not working and you're sitting for a long time, or you're sleeping for a long time, the metabolism of your body will not go long, and it will get down. After some time, the metabolism will be decreased, and your life expectancy in this also will get decreased by day, because of your working style, and your food intake and nutrition intake also getting less. In this ergonomics, what we call, so this today in ergonomics, we had seen many type of people, like those who are doing a repeated work, like those who are working in machinery industries. They'll use the screwdrivers or something, or the nuts and all, they use for repeated works and all. They'll get this tennis elbow problems. And those who are working in software industries and all, they'll work for most of the time for laptop and all, they'll have a neck pains and the low back ache and all. uh, so we had seen many problems and all in this type of patients. And second thing is, every 45 minutes, if you take a break on whatever work you're doing, that gives you more stretch in your life. And so there is some exercises in normal life to, whenever sitting for a long time, more than 2 to 3 hours, you should do some exercises like this. Like when you have stretch for more than 45 minutes, you're down, so you do a neck exercises, like you are staying for a long time, then you have to do a neck exercise like this, when you tilt like head like this, and the other side, you have to, when you have to stretch like this, so that this already spasm muscles and all, it will be stretched. So you'll be having a free in this neck muscles and all, you'll have circulation also will increase. And scapular retractions, there are scapular retraction exercises also there. It is like, so when your back is straight for a long time, you have a scapular retraction like this. So the scapular retraction exercises will help you to get this plasma exercise, plasma muscles and all, the trapezius muscles and all will get relaxed, and you get less pain in the neck. And for the low backache, there is a pelvic tilt exercises. There's a pelvic tilt exercises. You have to extend your body a little up like this and down, little up like this and down, so that the pelvic tilt exercises will help you out for a long time sitting in the same chair for a long time. Usually, I advise you to go for every 45 minutes break in an hour, so that if you're sitting for a long time, just stand up for 15 minutes and just go around and come, so that you'll have a the posture change, we call it as a posture change, so that muscle will not get strained, and muscle will not go into spasm. Usually so many people will ask me the same thing, like I'll get pain in a low backache or pain in the neck pains and all, is usually due to spasmodic pains. So, and stiffness will come usually after some time. When you are doing the same repetitive exercise, after some time the muscle fibers will get tear, so that it will get spasm and swelling and all, it will not get into attach, so that you have to give some rest for that muscle, and so that this swelling will come down, so that slowly the muscle fibers will have unite, and you regain your all the uh, walking styles and all. So, so many like regularly I see the many patients in OPD. So they have software people or something. So those who are sitting for a long time, they have this type of exercises, and the posture also very important. When you are sitting in the uh, straight position, already I explained you this, elbows should be extended, and uh, uh, and so you should be seeing the monitor in a straight way around 90 degrees and all, so that it will be clearly will have vision on the screen screen, and you can clearly view the screen, so that the straight sort of the screen will be on the top of the screen. So so you should not bend this neck like this and like that, so that the screen will be having a straight view, so that this neck strains and neck spasms will have very less modality on this. And most of the people are affected with tobacco influenced in this. Those who are sitting for a long time, they'll have a smoking and all. So those who are taking alcohol and all, those who are not getting sleep and all. So because of that, so they are because of this tobacco and all alcohol, they are, micro vessels and all will be very less. So then the micro vessel circulation and the circulation into the vessels and all, it will be very less, so that your circulation will be less, so that your immunity will also will get less in this COVID time. So be careful when you're smoking and all, and you're taking the alcohol and all in this COVID times. It will affect you more into the immunity, less immunity and all, so that uh, I'll say this and all. Next, as per our WHO guidelines, this work life and ergonomics and nutrition is, we'll call it as life blood for economy. Life blood for economy, we'll call in WHO guidelines. They told us whatever the working people who are is they call as life blood of economy. So those who are working for a long time and all, they are the ones, they are giving the economy to the WHO and all. Next. Yeah. So nutrition in this already I explained you. The nutrition is like most of the time nowadays COVID times and all. Everybody is asking me to get this. Uh, uh, what type of nutrition you should take in the COVID times? What type of nutrition is best for these things and all? There are number of stages or number of ages, like from the child age to the old age. The nutrition.
Dr. Manoj, if I may interrupt you for a minute, are you sharing any kind of presentation, doctor, or are you just orally taking it? I was asking if you're sharing any presentation, or are you saying this orally? Because are you showing any presentation, or you will take it orally?
Explaining you this.
Okay, all right. No, we just wanted to know if you're sharing and we're not able to see it or what. So I think that this is Ritesh's question. Ritesh was asking if we were able to see the presentation or not. All right, please go ahead.
Very less time, so that.
Yeah, so you were talking about nutrition for around COVID.
Yes, nutrition. So nutrition in this, it's like for the child and for the old age, there are a number of types of nutritions are there, and the immunity status for the children and the young age and old age. This young and children have immunity status will be having a little bit more, and best nutritions are there, and immunity will be best. But the old age, the immunity will be very less, so that they are more prone for these infections and are more prone for this COVID infections and all. So they should take all vitamin D. Vitamin D is a main source of vitamin D. Will help you in the absorption of the calcium and all. And vitamin C usually we'll tell for immunity booster. For that we'll take vitamin C in the number of cases we see that. And for bone improvement, like most of the time when you are not moving at all and all, so this bone in your bone, it will utilize that muscle will be utilizing the bone and the calcium, and it will be utilized for more time and all, so that you have to take more calcium in this COVID times and all. Rest of the things like exercise, daily 30 to 40 minutes of exercise is also very much needed in this COVID times. It will improve your circulation, and it will improve your muscle spasms and all, and it will clear your all the blood clots or any substance in your vessels and all. It will help you for a circulation in a clear way. And inside, yes. So yeah, when you are working for a long time, so those who are a short stature or something else, so those who are not touching the legs into the floor or something, they should use a footstool for a little bit high, so that they can put their hands or resting position in 45 degrees of angle. In 45 degrees of angle, if you put the foot and all, this all the back muscles and all, it will be relaxed, so that it will be free for standing for long time. And usually in working time, they'll have phone, or regularly they'll use all the phones on left side or something, so they'll use the phone in one direction and all. The other side of muscles will be usually strained and stretched and spasm, so that they have this type of problems in those who are using for mobile phones and all for a long time. And so the things whatever you are placing it for in your office or in your home, you are making it into that. The things should be very easy to hold it and easy to take it. That will be very helpful for you when you are using this type of things nearby. Or when you are taking it for, or when you are using an abnormal position to take it, then there is a small muscle tears, or it happens. So they'll have many problems in that stage also. And work life is some other, like surrounding community also very important to you, to whenever you are sitting for a long time or something, like your friends or your colleagues you're doing for in a working style. Usually they should help us for doing all the things in a mean way. If they are not in a good way or something else. So your work life also will be affected in many stances. I had seen this in my OPD. So far, I will conclude this in 3 points. Like every 45 minutes, we should take a break. Whenever you're sitting for a long time and seeing a laptop for a long time, or you're seeing the desktop for a long time, you should take a break at least 40 minutes. Every 40 minutes, you should take a break. And 6 liters of water, actually, like fluids, any type of fluids, you have to take it for 6 liters of fluids for a long time. Like in a day, you have to complete this 6 liters from morning to night. You have to complete this so that your hydration will be very nice, so that you can have a healthy life. And exposed to sun. This is also very important thing. Morning 8 o'clock and evening 4 o'clock. This is very important times. Those who are not sitting in the sun for at least 9 o'clock or 10 o'clock, they can't go to out and they can sit. 8 o'clock and 4 o'clock is the right time to sit in the sun, so that the tangential angle of the sun will give the D vitamin to you, so that the immunity status also will be built up for a long time. Salma, anything?
Yeah, thank you so much, Dr. Manoj. That were very useful tips that you've given us. Of course, what you have summed up with, in addition to giving breaks, regular breaks, and keeping ourselves very well hydrated and exposing ourselves to sunlight, plus doing some stretching exercises at regular intervals, practicing neck exercises, 30 minutes of daily physical exercise, and the fact that how we are sitting, our sitting postures, and how we should align the eye level to the screens and monitors. We should not be bending while we are watching the screen or our phones. All these tips are very, very practical, because unfortunately we do all of these, and which we should not be doing, which is really going to be very helpful. And the fact that we should use a footrest, because our homes are not really ergonomically friendly, like how our offices are. So all these are very functional tips that you gave us. One question that I have, I'll now open the session for Q&A by all of you. I'll start with asking you a question, and then I'll pass it on to the audience to ask. You said that from the nutrition perspective, vitamin D, vitamin C, and for bone improvement, calcium is needed. There are artificial supplements that everybody is using, but can we understand if there are any natural food supplements that we can take for vitamin D, vitamin C, calcium, and all that we can include in our daily diet?
See, definitely. Natural supplements is very much useful and very much good for your health and all, than artificial supplements. Those who are not having or not taken by orally or something else and all, with the natural supplement, artificial supplements, they can take it naturally. Vitamin C can be very much available in lemon, like whatever we are taking, like citrus fruits and all, what orange or any other things, it should be helpful for this in vitamin C. And vitamin D also, it will be available in salmons, fish, or some other, like in non-veg items or something else. We will get it in vitamin D, some very, very minimal quantity, those who are getting it, because that's why we are advising you to take vitamin D by oral supplements in artificial way than in natural way. And these are all immunity boosters for a long time. This not only this, say nutrition from the like some people we usually tell that take a protein of 20 milligrams or something. You can't take a more than 50 to 60 grams of a slice of chicken or something else. So, but in protein powder or in protein supplement, you'll get more protein what you want indeed in a daily day-to-day life.
Good. Okay. Thank you, doctor. So you were saying that good exposure to sun around 8 in the morning and 4 in the evening is ideal. So I have a question related to that from Komal. Komal is asking how much time we should sit in the sun for absorption of vitamin D.
See, yes. Komal, yes, you had asked me a very good question. Komal, 8 to 4, why I had chosen it? Because 8 o'clock is the sun, the tangential angle of the sun is correctly placed on the human being, and 4 o'clock is also the tangential angle at the edge. Before 7, like at 7 o'clock, the clouds, dust and all be there, it will not be getting into the right way. And after 4, after 5, it will not be there. And after 8, at around 9 or before 4, like around 3, it is more hard to sit in the sun. So, but the more effective way, if you want to sit in the sun, is like when you get it more is at 12 o'clock and 1 o'clock is the more best time to sit in the sun and get more vitamin D. But that's a very hot climate, so that nobody wants to sit on the time. So this I had suggested for 8 o'clock and 4 o'clock. And what time and how much time? That is half an hour to 45 minutes is the time. Usually sit in the sun with exposed body, like when you are exposing your skin or something. So then this skin will attract the UV rays of the sun. Then it will modify this the cholesterol or the fat surrounding by your skin. It will changes into the D vitamin, and it will help you out in for converting the D vitamin, and it will help you out to the absorption of the calcium into your bones. So in mean, it's half an hour to 45 minutes of time to expose.
So 45 to half an hour is needed for the exposure and the absorption of vitamin D to happen.
Yes.
All right. Thank you, doctor. So we have another question from Amita. She's saying, would like to know, sometimes the sunlight is not available or accessible. In such case, will sitting or standing under the sun, not under the direct sun rays, still help? She's saying direct sun rays, if she doesn't have access to direct sun rays, can she sit in an area where sunlight is reaching, not directly coming through?
No. So if you are sitting inside home, and if it is not like, it's not that sun is not touching you, and there is a glass in between you and the outside environment and all, the sun rays will not fall on you, and the UV rays will not fall on your skin. Then the D vitamin will not generate. Okay. So there is nothing like, if you sit in the sun only, the D vitamin can generate, because the sun rays will have the UV rays that will fall on your skin. With the glasses or something, it will filter. So no formation of the D vitamin when you are sitting inside.
Okay. So direct sunlight is important.
Yes.
So we have another question from Snayankar Datta. She's saying, I feel tired and lethargic during my work hours. I think this question a lot of us will resonate with. Is there any way to get this problem solved?
See, that is purely vitamin D deficiency type of symptoms. See, this is depressed or tired, or if you are not working from morning to evening, if you are sitting in the home also, you will get tired in the evening. That is because of vitamin D deficiency. Okay. So you have to take vitamin D tablets for at least 8 to 12 weeks, 60,000 international units weekly once, up to 8 to 12 weeks. So it will help you out in these type of issues.
Is B12 also important, doctor?
Yes, B12 is a different vitamin. So it helps you in the formation of the nerves and the layer of the nerve. So surrounded by the layer surrounded by nerve is vitamin B12. Vitamin B12 helps you in passing the stimulus or the activities, like from the sensations or the how quick you are. So vitamin B12 will help you in formation of the nerve surrounding layer, actually, so that you will be so active.
I see. I have a question from Ritesh here. He's asking, what are the good sources of B12 vitamin?
B12 vitamin. See, there are many, like you have a all veggies, all green veggies have this iron and B12 supplements and all, and this palak, what we are eating in daily areas, that have vitamin B12 and all, and all non-veg you get the B12. Not everywhere you get it, actually. Sorry, in non-veg, whatever you liver or any other things you get it, you'll get B12. But in this also it's there, but very less quantity. More you will get it in non-veg items, you know.
Okay, so vegetable you get it in limited quantities. In non-vegetarian food, it's more. There's abundance.
And when you're cooking more, when you are the non-veg items also, when you cook more, when you are heat more and all, that heat soluble vitamin, so that it will be soluble, it will be not acting to your body very well.
Right. So the next question we have is, okay. Yeah. So Ritesh, I think that answers your questions. Are you a vegetarian, Ritesh? Yes, he's a vegetarian. So for him, it's a challenge to have non-veg, of course. So vegetables, but yes, there has to be regular intake of that to increase your B12 levels. If there are any deficiencies, doctor, we can look at artificial supplement for a certain time and then move on to a regular inclusion of veggies in your diet, so that
Yes.
that is balanced off. Is that correct, doctor?
Yes, yes. We'll take into the all vegetarian items to the powder form, and the powder form we are giving into the. They're changing it to tablet form nowadays. See, vitamin B12 is mostly affected with injections than tablets, because tablets, it's a light soluble vitamin. We call as light soluble. Like when it is exposed to some light, small light also, it will be soluble into methylcobalamin into cobalamin, so that the status will not work for you as a vitamin B12. So that's why it is not available everywhere. That's why it's not plentifully available. It's very minimal quantities also, very minimal quantities in it. So that they will take all the veggies and they will take all the extracts from that and they'll give the vitamin form. But still, if it's exposed to sun, or if you're exposed to light, that soluble vitamin has been getting down, and you're not getting the right vitamin.
Okay. Another suggestion I would give to all of you is you can also ask any questions related to any of the body pains if you're experiencing, because we have been 6 months into the COVID scenario and all of us have been working home. So if you're facing any specific problem with your muscles or with your back or your shoulders, you can put those questions out also to the doctor here. So he can address you with some tips on what kind of exercise or stretching you need to alleviate those pains. Okay, then I'll move on to the next. Then I'll move on to the next question from Komal. She's saying normally sources say vitamin B12 is a non-veg only. So we have to depend on supplements only. So I think, Komal, we just answered that. If you're deficient of B12, then you go for artificial supplement and then get into a regular diet of veggies and non-veg, depending on your preference of food or cuisine. Yeah. There's another question asking me, doctor, multivitamin tablets are good to use. Somebody is asking, Kiran is asking, are multivitamin tablets good? Because most of the people use it daily. So are they good in the very first place? And if they are, what is the best tablet that you could suggest?
See, it's not like that actually. Yes, definitely. See, multivitamin tablets is helpful when you don't have the vitamins in the right place, when your body is not absorbing in the right place. Because see, when you see that the blood is the only part which will circulate to the brain, to all the toe parts and all. This is the only part which will circulate all the areas. Okay. So if the iron is not in a good way, your absorption, all if your this all vitamins will take and absorb into the bone. See, when you're taking D vitamin, it will go into absorption, and then it will act and it will get the calcium inside, and then it will absorb into the bones. So when you are taking the B vitamin, B12 and all, it will absorb and it will enter into the nerves and the system of brains and all, it will work clearly. So when your absorption system is not good, then whatever you take in a vitamin form also, it's not good. So vitamins, when you are deficient in some vitamin, you have to take that vitamin. If you're not deficient in vitamins, you should not take it. Usually in old age, like after 40 or 50, your absorption state of your stomach is less, so that you should take a vitamin and all. Not everybody should take a vitamin and all, and it's not a regular need to take it, everybody.
Deficiency, you shouldn't opt for taking it daily, is what you're saying, doctor?
Yes, yes.
Yeah.
Not.
Amita, you want to ask a question? You can please go ahead, unmute yourself and ask. No problem.
Hi, Dr. Manoj. So,
Hi,
good afternoon. I wanted to ask about, of course, neck and nerve kind of issue. Long back, I did have a spasm. Then I rushed to the hospital and he gave me a muscle spasm. He definitely checked if my nerves are okay by beating at the bones or something to see if there is this thing, a shake or what is it called?
What's your problem? You have a neck problem?
So that time for 5 days I took the tablets and I was okay. But suddenly, like every 8 months or 10 months, again the same issue. And now since 3 days I have it, and since I know it solves by not shaking too much or just resting it out, slowly it is reducing. But when I sleep in the night, morning, the sleeping is little tough. but this time it is on the left side from the bottom of your hair, till the shoulder behind, so is it because of the cold, or I don't know, sometimes I feel too cold. Is it the nerve issue? I'm not sure.
It's not like that. See, there is a spasm in your back muscles. Spasm means why it came. Why it came means there is a problem in the neck because you have overstrained or any other things happen, so that the back is strained. Then the muscles goes into spasm. Spasm means, like, see, when you are, this is a lumbar spine, but this is not a cervical spine to explain it. But whenever there is a spasm, the tight muscles will go like this. So that when it is very tight, all muscles will go into tight. This small type of disc will come out and press this nerve.
Okay.
This type of disc will come out and press the nerve. So then it will irritate and it will get pain.
Okay.
So this usually we'll check it in X-rays and all. The spaces comes down a little bit down, so that we will know that some problem is going on here. Okay. This is the thing. So there is a spasm for a long time that will be repeatedly bothering you for a long time. See, some doctor has given anti-spasm, like spasm has been relieved now, so that irritation has been come down. When you are doing the work again and again, see, they have to suggest you a lifestyle changes of exercise. Like when every 45 minutes you have to take a break, or you have to change the posture. Like when you're sitting for a long time, you have to stand up and go around and come here. So this is the one you have to do it regularly. Okay. Otherwise, this pain will come again and again. The spasm will goes into the more pressure on the discs, and the disc will get prolapsed.
Okay. Is it also related to B12? Because I do have a B12 deficiency. I've been taking injection shots.
Yes. When there is a disc prolapse, this prolapsed disc will touches the nerve, so that it will, this sheath layer around the nerve is B12. So it will completely erase that B12 layer and all. Then this irritation and this sensation and low backache, and your legs also will get irritated for some time.
Correct. Okay. Got it, doctor. Thank you.
So you have to take it an X-ray or something else. If there is a spasm there or not, so then you can go for regular things and all. You have to change a little lifestyle changes and all for that to not to come again and again.
Okay. Got it, doctor. Got it. Thank you so much.
No problem. Thank you.
Thank you, Amita. I hope that addresses your query. Any other questions? I invite you all, if you have any questions, please let us know. We have the doctor here to address any questions you may have. Till we get the next question, doctor, because we've been interacting with a lot of people and doing, wellness initiatives with a lot of clients. There is a regular problem with IT, IT employees talking about is the increased pain in the neck these days. So any small tip or exercises that you can demonstrate here so that, that can help in alleviating those pains?
Yeah, I'll explain you clearly. So just a minute, I'll show you my. See, this is total whole spine anatomy. Okay. In this, usually it shows in a S-shaped manner. Normal spine will show as S-shape. So all the people, whoever they're having a neck pains, they started from here only. Like there is a head, it will weigh around 20 to 30 kgs around. Like depends upon the people. Like for around 10 to 15 or 15 to 30 or something else. This all weight has to go into the neck and surrounding muscles. So the surrounding muscles will take 50% and the neck will take 50%. Neck bone will take 50%. When you're repeatedly pressuring on this one or repeatedly straining on your neck like this for one posture, see the other side of muscles will get into the spasm. And the rest of only 25% of muscles will act, and the all weight has to be taken to the bones. Then the pain starts on the bone first. Then all the spasm. So this due to the weight on the neck from the head. Why? Because you are sitting in the one posture for a long time, and this will strain the muscles for one side. The other side will have the problem. So all the muscles will take into the spasm. See. So this is the neck part. So this is the bone. This is 50% of muscles on your back and 50% in your front. So when the neck bone is 50%, it is taking. So when these muscles are strained or spasm, when you are sitting for a long time like this, or long time seeing phones, long time reading and posture, this backside muscles and all will be affected for a long time. And this whole weight of your head has to be bear from anterior muscles and the bone. So in this pressure on the bones will give you more effect on the bones. It will get crushed. Then it will start pain. So then it will get spasm and all for some time. And when they want to do like this and like this small tilt type of things also, they'll get more pain. So this is the one cause for most of the people, 80 to 90% of people is because of this one. And those who are traveling for a long time in car or something else, these people also has to take a break of around 45 minutes. Every 10 minutes they have to take a break. Otherwise, these neck muscles will get strained for a long time, and they can't move this head for this side and that side also.
Okay, so regular neck stretching is also important, right, doctor? Regular neck stretching exercises. Yes. Okay. I have a question from Sunanda. She's saying, what exercise do you recommend for knee and lower back pains?
Knee, yes. See, there are two type of questions like knee pain, usually in young age, because of when you are sitting like this for a long time, all your lubricant, like synovial fluid, what we call it as, it will drop and settle here as a gravitation force is coming down. So it will settle here. So what happens to your kneecap and the knee, these things? So it will get dried. So when you're sitting for a long time, when you want to stand up, then this rubs here into the other bone. So then small flake type of things happens and it rubs on the dry area, so that the knee pain starts. Usually in the young age people. Old age, it will get arthritic, so that it will get pain. But in young age also, so many people coming with the knee pain is caused because of this. And so when you are starting, when you stand up and you want to walk, no, every time I will say that, so extend your knee and flex your knee for at least 2 to 3 times or 5 times. So that the lubricant will go up to this area and will get totally circulated, and your knee get lubricated much, and you will get free access. And those who are getting arthritic changes or knee has weak things and all, so they have to do knee strengthening exercise. That's called hamstring strengthening exercises or quadricep strengthening exercise. This is the hamstring strengthening exercise and all. This is the quadricep strengthening exercise and all. Hamstring is this and quadricep is this. When you're putting it knee for tight for 30 seconds in a leg straight man, so that you'll get all the muscles will get recirculated and re-nourished much, so that the muscle will take more strength and it will not give all the pressure to the bone or the joint, so that knee pains will come down. And second question, your low back ache. Low back ache is like back strengthening exercises are there. Those who are usually, when there is a back ache, you should not do any exercises, because these back muscles are already in spasm or tight in that. So when you're doing any exercises on that time, it will get not stretched. Usually the muscle will be stretched, or elastically it has to be expanded like normally. But when you are in a spasm, when you are in a pain, when you are extending it, it will get tear. So when you get tear, the pain will not go, and the pain will get more and more day by day. So when you're having a spasm and pain, you should not do any exercises initially. After 2 to 3 weeks, after taking a medication or something for relieving that spasm, then you start exercises for back strengthening exercise for a long time.
Yeah, I hope that addresses your question, Sunanda. For knee pain, doctor suggested that you need to stretch your leg with your knee at 90 degrees. You stretch your leg straight, and that would help. Frequent stretching would help. That's one. And for your lower back, if you really have problem, first you need to have some medication, and then do the exercises, right? So that's the question. Any other questions? If you have, we have very limited time now. Probably we can take another 1 or 2 questions more, and then we'll close for the day.
I have a quick question.
Yes, yes.
Doctor, that medication is compulsory during muscle spasm to relieve the spasm, or by continuous rest for 3 to 5 days, it will go on its own. What do you suggest?
See, now everybody is in a fast and so fast generation. Nobody wants to take leave for at least 5 days. 5 days is a big period. Now everybody wants instant relief. So they wants to go to work. Those who are in working, so they want some leave and all. Those who are making them work, they don't ask for leaves and all. So everybody wants instant work, like instant things and all. So then you need to take these tablets and to go to, or else there are many things like you have, as you said, if you take rest and immobilize, you are immobilizing the body for at least 3 to 5 days, so that it body has a tendency, if you don't do anything to your body also, it will heal on its own.
It's on its own. Absolutely. Yes. Absolutely agreed. Thank you so much.
Okay. Thank you.
Thank you so much, Doctor, and thank you all of you. Dr. Manoj, this has been very insightful, some very, very practical tips around ergonomics, around nutrition, and I think a lot of problems and solutions you've addressed. Thank you so much for being a part of this session and helping us out with all the questions we had. We look forward to have more sessions with you on this. Thank you once again, everybody, for being part of this, and please do join our other wellness sessions, which are around problems and challenges related to COVID. Thank you so much once again, and we'll close for the day. Thank you. Bye-bye.
Thank you very much, Nasrin. Yeah.